2 years ago, Olympic gold medalist Tori Bowie died of complications of childbirth at home because she didn't want to go to the hospital. Whether that was because she had seen videos like this one, or because of her own personal experiences or stories she'd heard, she didn't feel safe going there. After her death, her teammate Allison Felix, who'd also had pregnancy complications requiring an emergency C-section, wrote this piece in Time magazine about how important it is for us to raise awareness of the Black maternal health crisis in this country. As I've said before, the primary reason behind this crisis is racism. Black women in this country are 3 to 4 times more likely to die of pregnancy-related complications than are white women. And there are different ways that racism plays into this. For example, things like environmental racism and differential access to housing, differential access to justice through the legal system, all contribute to worse health outcomes for Black people in this country. It's easy in that example for Dallas Regional Medical Center to blame that one nurse who was clearly just egregiously ignoring the patient's distress and not offering that patient the care that she needed and deserved in that moment. But when we do that, we're ignoring all the systemic and structural issues that contribute to the worst healthcare outcomes, and specifically maternal mortality health outcomes for Black women in this country. Some of you may recall Brittany Watts, who was arrested in Ohio when she had a miscarriage at home. Ms. Watts had been to the hospital not once, but twice, trying to seek care for her miscarriage. And both times they had taken so long to take care of her that she went home. And when she had that miscarriage at home, she was arrested. Some of you may recall what happened to Serena Williams, who had to fight for the test that she needed to show that she was having another pulmonary embolism after her delivery. The team taking care of her didn't believe her when she told them that she was having difficulty breathing, but she recognized those symptoms because she'd previously had a pulmonary embolism and ultimately was able to convince them to get her the CT scan she needed to make the diagnosis and get her the treatment she needed. Higher levels of income and higher levels of education are not protective for Black women in these scenarios. We have a healthcare system that is embedded within a society that is racist and also misogynistic. And so we have those two factors compounding into what's called misogynoir. It seems relevant here to also point out that the entire field of obstetrics and gynecology was founded by a racist man who experimented on enslaved women and refused to give them pain medication. So to me, the question is not, how is it racism if the person didn't seek care? The question is, how is it not? And unless and until we recognize that these are not isolated incidents happening here or there, but are part of a large pattern happening at hospitals across the country every single day, we will be powerless to change it.